So on this Instagram live today, I'm going to be talking about testosterone, but I'm conscious that I've already done an Instagram live that's on my YouTube about testosterone, so I thought I'd do things a bit differently today. I have had so many questions, thank you very much, that you've all asked about testosterone. So what I've done is I've transferred them to my laptop, and I'm going to just go through them and see how many I can answer in half an hour, because then I thought it would be more useful for you. So there's so many questions, they're not in a particular order, I'm just literally going to go through them in a sequence, and hopefully that will help. Now, before I get started, just to remind you, testosterone is just a hormone. We've got hundreds of hormones in our body, and hormones are just chemical messages that go around our bloodstream, tell our cells how to work. Testosterone is one of these neglected hormones, and often confused hormones actually. Testosterone is a female and a male hormone. We produce it in our ovaries, our adrenal glands, our muscles, but also our brain. Our brain actually makes testosterone. We have cells all over our body that respond to testosterone. And actually, as women, when we're younger, we have more testosterone than estrogen in our body, and levels start to decline with age. So it's not really a menopause related decline, it's more an age related decline. So our levels are greatest when we're in our roughly sort of mid-20s, and then they decline with age. Some studies show there's a little upturn actually when we get older, but because about half of our testosterone is produced in our ovaries, if women have their ovaries removed at an early age, they're going to lose testosterone like overnight because their ovaries are removed. So a lot of those women really notice a loss of testosterone quicker than others. It's a hormone that's involved in lots of metabolic processes. It's good for the way our brain works, our bones, our heart, everything, even going down to our mitochondria. We've got receptors for testosterone on our mitochondria, which are our power. They're the part of our cells that produce the energy for all our reactions to occur. We have other hormones, so we can obviously live without testosterone, but many of us experience symptoms if we don't have testosterone or we don't have enough testosterone in our bodies. So I have done an Instagram live about testosterone. There's also some resources that we've got, and I've done some podcasts as well, and I'll share some links in my stories later. But today I just thought I'm going to answer some questions. So I'm going to put on my glasses and answer. So I hope it's going to be helpful for you. So one of the questions here is, let's start. Does it help with mood? I've been on HRT for 7 months. Now, testosterone, if you look at the guidelines, it says we can consider testosterone if women have reduced sexual desire despite taking HRT. Many women who have low mood also have reduced sexual desire, but we do notice, and we've just had a paper published in a peer-reviewed journal to show that women that we see, when we add testosterone for reduced sexual desire, actually mood symptoms improve, as do memory as well. So it can often, and certainly in my vast clinical experience, a lot of women we see have been under psychiatrists, their mental health hasn't improved, they've had quite heavy duty drugs, sometimes even ECT as well, electroconvulsive therapy. HRT might help their mood a little bit. Adding in testosterone can be transformational for some women. Obviously there are other reasons why people have mood changes, but you can still have psychiatric medication alongside HRT with testosterone. When should we start asking our practitioners about testosterone, and is it only for low libido? Like I say, the guidelines currently say it's for reduced libido, but many women offer notice that it can improve in other ways. It's impossible to know who's going to benefit from testosterone. Often what we do is do a baseline blood test. If the level's low and symptoms are suggestive of testosterone deficiency, we give what's called a therapeutic trial. So we try testosterone, do the level to make sure it's being absorbed, and then review people after 3 to 4 months, and if they're starting to improve, it often suggests that their symptoms are related to testosterone. Is all testosterone replacement body identical, or are there synthetic ones as well? This is a really great question, because what we want to do with any of our hormones is to replace what's missing in the same way, so the same biological chemical structure, if you like. So I've spoken many times about the advantages of having estradiol, progesterone, which is the same structure as what we produce, exactly the same with testosterone. there are more than 300 synthetic testosterones available that you wouldn't want. A lot of them are available in gyms or various other places, but they've been chemically altered, so they're not going to have the same biological advantages of natural testosterone. So when we prescribe testosterone, certainly in our clinic, we give either testosterone cream or gel, which is the exact same structure as the testosterone that we make when we're younger. What is the normal level of testosterone in women? Levels really vary, actually, hugely vary, and it depends on the laboratories, it depends the way they test it as well. We tend to do testosterone and SHBG, which is sex hormone binding globulin, to work out this ratio called free androgen index. But it's only a guide. You have to be really careful sometimes with the laboratories when you have blood tests done, because especially many NHS blood tests will say it's normal even if it's really low, because the computer's only been taught, if you like, to flag if it's raised. So if it's low, or even I've seen people with no testosterone at all and the computer says normal. So if you have a blood test, you should ask what the actual figure is. It depends on the laboratory, but generally if it's less than 1.5, in the UK, those figures, then it's usually low. Having a low testosterone doesn't mean it's causing your symptoms though, so we have to interpret it in clinical context, of course, as well. How important is testosterone in women who have Parkinson's? Well, Parkinson's disease is a neurodegenerative disease. We know actually, there's a good paper by Rocker that came out a couple of years ago, someone called Walter Rocker from the Mayo Institute, and showed that women who have an early menopause, a surgical menopause at a younger age, have a higher risk of neurodegenerative diseases, including Parkinson's. We haven't done, or there haven't been good studies showing what's it like giving testosterone with HRT for women with Parkinson's. But we do know that it affects the dopamine pathways, it affects the pathways that are associated with Parkinson's, and we also know that testosterone is good at helping the nerve conduction as well, and improving muscle strength, affecting muscle tone. I've got some patients with Parkinson's who've found that their Parkinson's has stabled and not progressed as quickly as it was before they started HRT with testosterone. That's just some clinical observational work, not actually any studies, but there's no reason why people can't try it. It's not going to interact with any Parkinson's drugs either. Where can we get it in the UK? It's a massive question and it's really hard to answer because it depends. So it's not licensed for women. Testosterone is not licensed for women. They used to have a patch called Intrinsa, which was licensed for women, but they decided to stop making it, and then they withdrew the license for no reason. It wasn't a safety reason or anything like that. But we prescribe a lot of medication off license, a lot of medication, for example, for pregnant women, for women, for people who are children, for example, but also like we give medicines for different indications. So for maybe for stopping migraine, we give epilepsy medication. It's not licensed for migraine, but we know it's helpful. So we do have a licensed testosterone preparation, which is the testosterone for men, because of course men can have testosterone. So we can prescribe it off license at lower doses, and that's usually the gel. And then there's the Androfem cream, which is licensed for women in Australia, but in the UK we can prescribe it privately. So these are regulated products that are available. Now, not every GP is allowed to prescribe testosterone because it depends what's on their formulary, which is very restrictive for some GPs. I see a lot of GPs who are really frustrated that they're not allowed to prescribe it, even though they are trained, they know how to prescribe it. Some GPs haven't done any menopause training, and they are referring people to gynecologists, but not all gynecologists have done menopause training. It's actually very easy to prescribe. It's very safe. It can be very effective. I don't know why it's so difficult for people to get hold of. Someone says, is it better to apply gel over muscle or fat? Actually, it doesn't matter, but the absorption can really change. So if people find that they're putting it, say, on their thigh or their bottom and they're not absorbing it very well, we might suggest to put it somewhere where there's less subcutaneous fat to try and improve absorption, because even location of not just testosterone but estradiol, that the site can make quite a difference. How often should you have your testosterone levels checked? Usually, like I say, we do them at baseline and then we review women after 3 to 4 months in the clinic. And then if they're feeling well, their levels have come up but still normal, then we usually see them every year. So usually we recommend women should be seen every year anyway, if they're on any type of hormonal treatment, including testosterone. If people are having symptoms suggestive that they're still are having symptoms of testosterone deficiency despite being on testosterone and their levels are low, we might increase the dose and then review them again after another 3 to 6 months. So it's very individualised. Lots of people come to our clinic literally just for the testosterone because they can get the HRT part on the NHS and they need testosterone from us. Sometimes when we start testosterone and people feel better, then their GPs will carry on prescribing it for them, because obviously what we prescribe in the clinic, we prescribe the gel, it's exactly the same as the NHS testosterone gel, and a lot of GPs feel more empowered and reassured that we've started it and they know how to monitor because we give very detailed clinic letters, and then GPs take on the prescribing thereafter. Hoping it helps with sleep. Its most troublesome symptom can't get past 3 or 4 o'clock in the morning. It actually can. We've found that I certainly know that one of the first things people often thank me for when they have a review appointment is getting their sleep back. It's not just actually for, it's not just testosterone, estradiol and progesterone can improve sleep, but certainly testosterone really can make a difference, and it seems to help the quality of sleep. So people might not need as much sleep, but the sleep they have is often really good. So, but it varies between women, but certainly in our clinical experience it can. I've got Sjogren's syndrome that's getting worse. I've just started testosterone. Will it help? So Sjogren's syndrome is associated with dry mouth, dry eyes. It's thought to be an autoimmune condition. Anything that's autoimmune, we need to be thinking about female hormones. Anything that's more common in women than men, we need to be thinking about, is it related to estrogen and progesterone, or is it related to testosterone? And we see a lot of people with dry eyes, dry mouth that might improve with HRT, but often improves with the addition of testosterone as well. It's really worth making sure all 3 hormones are optimised for you, and it can help. Can we only get it privately, or can we get it from our GP? Yeah, it really depends on your GP, but it is worth asking. Does testosterone convert to estrogen? Can I use it alone because I've had an estrogen receptor positive breast cancer? Now, progesterone is actually broken down to testosterone, and testosterone is aromatase to estradiol, which means it's the aromatase enzyme that converts testosterone to estradiol. There's a theoretical risk that testosterone can convert to estradiol, but actually in our clinical practice we don't really see it. We're just going to do a study looking to see whether levels change at all, but if they do, it's really not very much. Estradiol is the very anti-inflammatory nice part of estrogen, and so it's better than estrone, which is what our fat cells produce, for example. So often it's more of a theoretical concern than a real concern. Some people who've had breast cancer, we do offer and talk about testosterone on its own without giving HRT. Obviously, if someone's on an aromatase inhibitor, any conversion is going to be inhibited anyway, but it's certainly worth talking about. Let's go to the next page. Is it better to take daily or twice a week like I have been told? So usually I recommend having it every day, because when we're younger we produce testosterone every day. When people have it like just once or twice a week or even every other day, they often don't improve as well, and that's because they're getting quite a high dose one day and then nothing the next, and there's this sort of yo-yo going on. So I think it's better to have a low dose every single day. What's the best place to apply? Do you decant the packet into a syringe and put it into the fridge? So the testosterone sachets is a bit of a faff, because men usually use the sachet once a day, but obviously you have to eke it out and use a small amount every day. If you're using the testosterone gel, some people just use a paper clip and then use a small amount every day. Some people put it in a little pot and then just like literally get it out of the pot each day. It depends on how long you're using it for, and that it depends on your absorption and your levels, but it's usually something, as a general rule of thumb, obviously I'm not giving individual advice, is between like 5 and 8 days that the sachet lasts for. So So it depends which easier for you. It doesn't have to be kept in the fridge, but it shouldn't be in a warm place. What do estradiol levels have to be at before we can start testosterone? Now, there's a lot of thought, or like older school thought, I think, that people have to have adequate estrogen before starting testosterone. And when I've asked people why this is, it's actually quite outrageous. They've said it's because they want to make sure that women are well estrogenized before starting testosterone, because as their libido improves, they wouldn't want sex to be painful. Now, there's lots of reasons why sex can be painful, and it's not just due to low estradiol. And there's lots of reasons we give testosterone, and it's not just to make sex not painful. So I don't think that's a good enough reason to withhold testosterone. A lot of women actually want to start testosterone the same time as HRT, and I think this is a very individualised choice. They're 3 different hormones, they work differently in the body. I don't really understand why we have to withhold testosterone, which often has a real benefit from women, than waiting for the other 2 hormones to work. And again, in the clinic, we talk about the options about whether they want to start HRT first and then come back for a review and consider testosterone, or whether they want to start testosterone at the same time. And I feel very strongly it's up to women to decide about that. Hang on, some of these are repeat, that's why I'm hesitating. Let's go to the next page here. Does it make you gain weight? No, not usually. Often testosterone can convert fat to muscle, actually, and people find it often easier to lose weight when they're on testosterone, just because they're more active, they're sleeping better, they're moving better, they're exercising better, and often they don't have the sugar cravings the same way as well. So we haven't got good studies, but whether it's the testosterone that directly loses weight or whether it's just lifestyle because people are feeling better, it's difficult to know. Where to apply it when I'm already applying the estrogen gel? Well, estrogen gel is often put on the outside of the arms, the insides of the thigh. Testosterone is usually on the outside of the thigh or the buttock, so you can usually have enough skin to put both on as well. What's the best time of the day to apply? It doesn't matter. Whichever works for you really is the most important. Is 0.8 a normal range? No, that's usually low, but again, it's in clinical context if you've got symptoms. How do you get it prescribed for HRT by the NHS? What exactly do you have to say? I mean, its usual indication is reduced libido, but again, it varies so much. Doing the tour that I'm doing, I've spoken to so many women who are struggling to get testosterone, and there are some clinics that people have told me, even their menopause clinics, are refusing to prescribe testosterone. I'm not really sure why, especially if they're refusing because of women, or for women who have reduced libido. Like, it doesn't really make sense because that's in the guidelines. If someone's got low testosterone, they've got reduced libido, and they're on HRT, I don't really understand why we can't try it and see. Lots of things in medicine, we give a therapeutic trial, we try something, see if it works. If it doesn't, we change and give something else. So I don't really understand why it's so hard for women to access their own hormone, and certainly a lot needs to change about that. My GP stopped my testosterone as my levels came back high. How long should I wait to recheck levels? Now, when people do levels, it is only a guide, and often levels really vary. So if someone has a high level and they're feeling well, so they've got no side effects at all, they're feeling great, they feel better, then I wouldn't automatically change the dose. What I would do is suggest to have another blood test in a few weeks' time, because it might have been an aberrant result. It might have just been high at the time that the blood test was taken, and then later on, or even earlier, the level was okay. So it's like anything in medicine, we don't just act and react on one single blood test. We need to put it into context. Like I said, side effects of testosterone are incredibly rare and unusual. If people get side effects, it doesn't always mean a dose-dependent effect. Some people are just more sensitive to testosterone than others. The commonest side effect is actually where people rub the testosterone on over their skin, they can get some hair growth. So if you rub it on your thigh, you might get a bit of hair growth on your thigh. But people don't usually have beards, moustaches, that don't normally get skin changes. If people were prone to acne as a teenager, then it might just flare up acne again. It's almost like taking the bodies back to how it was before. But some women say, do you know what, I feel so much better, I'll treat my acne and I'll carry on with the testosterone. Voice changes are incredibly rare. I've got one patient who bought testosterone over the internet, was using the wrong dose, her voice changed, she stopped using it and her voice came back to normal. So we do know it's very unlikely to have like permanent problems with voice, but most people I see, well in fact the majority, I've only seen 2 women who've had voice changes out of like 8 years of running a clinic where we see thousands of people. So it's very unlikely. People talk about enlargement of the clitoris, clitoromegaly, but in my experience, a lot of people notice atrophy, sort of reduction in size of the clitoris, and it can often come back to a normal size. I don't see people with very large, uncomfortable clitorises. Maybe that's if you use a really high dose, but in my experience, just giving the right dose to the right person, we don't have that as a side effect. Some people feel a bit agitated when they first start testosterone, and those are often people who have very low levels, and it's almost like their body's going, gosh, what's going on here? And so we usually just say start with a very low dose and then gradually increase over a few months, and any initial side effects usually don't cause any problems. How long to see effects of testosterone replacement? We usually say it can take 3 to 6 months to have an effect, so you have to be really patient. So what we normally do is, like I say, review after 3 to 4 months, make sure the level is increasing to make sure it's being absorbed, and if people don't feel better after 6 months, again we would review the level, make sure that they were on the right dose, so rather than saying it's not working, but it can take several weeks or several months to have an effect. Some people notice even a quicker improvement. Will it help with bladder and urethral pain? Sometimes it can, and quite often actually it helps with urinary symptoms as well as vaginal symptoms and localised symptoms. We've got androgen receptors in our vulva, vagina, clitoris, pelvic floor, bladder as well. So it makes sense that when we use testosterone, a lot of urinary symptoms can really improve. We also often use vaginal DHEA, which converts to estrogen and testosterone. So that's another way of having more testosterone locally. We haven't got testosterone pessaries, but if the DHEA converts. But usually systemic testosterone can make a big difference as well to bladder type symptoms as well. Can low testosterone cause fatigue, low mood as well as low libido? Yes, it can. My blood level is in normal range, but I feel I could benefit. Could I pursue? Again, we don't know what the normal range is. Everyone's different. Women, for example, with PCOS, polycystic ovarian syndrome, often are used to a higher testosterone level. So they might have a normal testosterone level compared to other women, but it's low for them. So it's taken in clinical context. I wouldn't start testosterone if someone had a high level and they weren't on anything. But if their level was normal or low and they had symptoms to suggest testosterone deficiency, then what I would do is repeat it, maybe if I wasn't sure, or like I said before, I would try testosterone and see whether it helps with any symptoms as well. So again, like levels can range. If you do lots of levels in one day, you're going to get lots of different results. And so just looking at one blood test is not always that useful as well. Can side effects of increased hair on application side settle down? Yes, they can often, but it really varies. Often it's worth changing the location and seeing, so not always putting it on the same leg on the same site every single day. Some people seem more prone to this local hair growth than others, but many of us, even if we have hair growth, find that our symptoms are so much better, we can cope with some hair growth on our legs. Do you have to get your others balanced before looking at testosterone? I've mentioned that as well. My endocrinologist says it's only for libido and taking too much can cause cancer. I think that's quite hard to say that it's only for libido, but even if you look at Freud's definition of libido, it was pleasure of life as well. But we know that testosterone works as a neurotransmitter. It affects levels of dopamine, for example, in the brain, which is our reward hormone, so it helps with pleasure in how we experience like day to day as well. It also helps to rebuild the myelin sheath, which is the conduction pathway of the nerves. It helps the nerve, the synapses, the way our messages go from one nerve to the other. It also helps with muscle and bone strength as well. we know from studies that women who have low testosterone have a greater risk of cardiovascular disease. We haven't had the studies to show that whether replacement reduces cardiovascular disease, but we have lots of studies in men, so it is likely to have a beneficial effect on reducing risk of heart disease, osteoporosis and dementia as well. So it's hard to say that it only works for libido because we've got testosterone receptors all over our body. Causing cancer, natural testosterone, I don't see how it can cause cancer because young women who have high testosterone or higher testosterone levels don't have an increased risk of cancer. It's very anti-inflammatory. It induces apoptosis, which is programmed cell death. It helps with the mitochondria to work, and if our mitochondria work well, we're less likely to have diseases such as cancer. The synthetic testosterones might be associated, but natural hormones, including natural testosterone, I don't see how it can increase risk of cancer. 61, is it too late to try testosterone? No one's too late to try hormones. Would it help with vaginal dryness? That's the same as the urinary symptoms. It often can. Let's see what else. My doctor doesn't know how to prescribe it to me. Well, on our website we've got details, but we've got an easy HRT prescribing guide, which you can just Google easy HRT prescribing guide Newson, and it should come up. And you can download that. It's evidence-based. It's got references on it, and you can show that to your doctor because it has got testosterone on it as well. Is testosterone being made available on the NHS? Well, it's going through for licensing at the moment, but that seems to have been taking years. I don't know why it's taking so long. I think the MHRA, the Medicines Health Regulatory Authority, don't see it as a priority. I don't quite know why. And in other countries, it's not licensed either. It's only in Australia, but a lot of Australian women I speak to actually can't get hold of testosterone, even though it's licensed in their country. So it's really difficult. It's finding a doctor that understands is definitely worth it. And like I say, when people come to our clinic for testosterone, it's quite often GPs will take over prescribing after when women start to improve on the testosterone. Does it help with driving anxiety? I've seen a lot of women with crippling anxiety that has improved with testosterone. Anxiety to drive, anxiety to go on a bus, anxiety to go on a tube, anxiety even to go on a holiday. That doesn't improve with HRT. Their testosterone levels are low, and it does really improve actually with testosterone. Not for everybody. Your anxiety could be due to lots of other reasons, but if it's associated with low testosterone, then it can. I'm on HRT for a year but still feel exhausted. Well, it might be worth thinking about testosterone. Obviously, there's other reasons for fatigue, so it might be, making sure that you see someone who understands that it's not just blaming hormones for all the symptoms, of course, looking at everything in a bigger picture, but considering testosterone as well. Can you be on testosterone forever? It's the same with other hormones. Then yes, you usually can, as long as benefits outweigh any risks. There's no reason why people can't be on testosterone forever if that's what they want to. It doesn't seem right or fair or biologically reasonable to just stop a hormone that's having beneficial effects in our bodies. So there's no reason to stop it at a certain time. I'm using Testogen as prescribed but don't feel any different. Why not? Well, that might be because you're not on it long enough, or it might be that you're not absorbing, and so then it's worth being reviewed, having your blood levels done. Sometimes we change from the gel to the cream, or sometimes we change from the cream to the gel. So if people aren't improving, they're not absorbing, there's no point just keeping increasing the dose. If it's not going through the skin, any dose isn't going to go through the skin. So changing the formulation might help. Also changing the application site. So from the thigh, for example, to the bottom. Occasionally we say rub it onto the back of the shoulder, because there isn't hair follicles. You're not likely to grow hair there, or even the inside of the arm. People sometimes absorb it better that way. So it's just individualising it. Will it help my brain fog? Currently on estrogen and progesterone. I mean, the commonest symptoms it helps is memory problems, sleep, like brain fog, mood, energy, concentration. Those symptoms can really improve actually, and of course libido as well. Someone with endometriosis, would you start progesterone first and add in testosterone later if needed? Often, yes. So with endometriosis, sometimes I've even started testosterone first to reduce inflammation, consider progesterone, and then estradiol if needed. It's really important that it's very individualised when we decide which hormone to give, at which dose and which order as well. Is it correct that 50% of testosterone can be lost by the age of 35? Yes, it is actually. It really does reduce, and it varies so much between people. A lot of these questions are the same, and I'm nearly up to the half an hour. Just here, a little about the link testosterone with lichen sclerosis. Lichen sclerosis, I think, is actually predominantly due to low testosterone. I'm seeing some women who are using prasterone, which is the vaginal DHEA, who have lichen sclerosis, and they have the most amazing results with it, really transformational, and they've been using vaginal estrogen for years, hasn't made any difference. There's no studies, I don't know why no one's doing any studies that I know about lichen sclerosis, and if you know of any, please get in touch with me so I can share them with others. But I think testosterone, any vulvovaginal symptoms that don't improve with HRT and vaginal estrogen, then certainly to consider testosterone and vaginal prasterone as well. And also urinary symptoms. Just the last few years I've had some amazing results with women using testosterone with DHEA in addition to HRT. So that's the half an hour up. They've still got loads more questions, but I think they're the commonest. Lots of them were repeats. I hope you found that useful doing it this way. If you didn't, if you found it too chaotic and jumping around, let me know and I won't do it again. If you did find it useful, I'm happy to do more Q&As at weekends. I just want to use your time really in the best way. So I'm very flexible. I can do whatever the majority of women would like. So when I post this on my grid, just put in the comments how you would like these Instagram live sessions to be, and I can do exactly what people want. I really feel it very privileged to have so much knowledge. I want to just share it with people so they can make the right choices for themselves going forwards, and hopefully more women will be healthier and happier and be more empowered with having knowledge about hormones. So thank you for joining on a Saturday. Tomorrow I'm back doing the tour. I've got 10 days left. If you go onto my website, drlouisenewson.co.uk, and look at tour, the tab for saying tour, we'll have the list of dates. There are a few tickets left in some of the venues. It's had great feedback so far, and I'm really enjoying doing it and meeting so many people. So if you want to come and enjoy learning more, then book a ticket, and I will see you next week. I'll work out the timing when it's a bit closer, but I will do it earlier because of the tour next weekend. So have a great rest of weekend and enjoy your week ahead, and thanks for all your support.